Imagine, just for a second, the sheer scale of the UK's cosmetic and personal care sector.
Right.
We're talking about an industry that contributed a staggering 24.5 billion to the economy in 2022.
Hmm.
I mean, it is a financial juggernaut.
It really is.
Now, picture yourself walking down your local high street. You step into this, pristine, brightly lit clinic, sit back in a plush leather chair, and prepare to get a dermal filler injected into your face.
As so many people do every single day.
Exactly. And you naturally assume the person holding that needle is highly qualified. You assume they're heavily regulated. You assume they carry, like, comprehensive medical insurance in case something goes wrong.
Because why wouldn't you?
Right. But astonishingly, there is currently no legal requirement in the UK for practitioners of non-surgical aesthetic treatments to have any specific qualifications, training, or even insurance.
Yeah, it is an incredibly stark reality to wake up to. I mean, we instinctively associate needles, clinical environments, and, physical alterations with strict medical oversight.
Right. You see a white coat and you just assume.
Exactly. But right now, for millions of consumers, that assumption is just a dangerous illusion.
And that illusion is exactly what we are focusing on today. Today's deep dive is built on some, frankly, groundbreaking new frameworks. Specifically, the comprehensive 10-point plan from the Joint Council for Cosmetic Practitioners, or JCCP, and the government's latest consultation document on licensing non-surgical cosmetic procedures.
Two very heavy, very important documents.
Yeah. And our mission today is to unpack how regulators are finally trying to tame this wild west of the aesthetics industry to keep you, the consumer, safe.
Okay, let's unpack this. Because whether you are a skincare enthusiast, a medical professional, or just an insanely curious learner, this deep dive is going to completely change how you view the high street aesthetic clinic.
It really will. And, to really grasp the solutions being proposed in these documents, you first have to understand the sheer scale of the current regulatory void.
Yeah, paint that picture for us. How bad is it? Well, the reality we are operating in right now is incredibly fragmented. There is no national record of who is providing these treatments. Think about the implications of that.
Wait, there is no master list at all.
None. Zero. We quite literally do not know who is out there injecting foreign substances into people's faces.
That is mind-boggling.
It is. There is no mandated best practice across the board, and crucially, there are no legal restrictions on who can perform these highly invasive procedures.
But surely someone is keeping an eye on this.
Well, some local authorities have tried to step into this void. Like, if you live in Nottingham, Essex, or London, there are varying local schemes and bylaws under older legislation, but it is a total patchwork.
Right, so it just depends on your postcode.
Exactly. You cross a county line and the rules change completely. There is no standardized national law protecting the public.
I was trying to think of an analogy for this, and it's essentially as if anyone, literally anyone off the street could legally buy a scalpel, set up a folding table in their garage, and start operating.
Yeah, that's actually not far off.
Meanwhile, the hairdresser down the road who, cuts your hair, has more stringent, enforced health and safety oversight from the local council than the person injecting a medical device into your cheek.
That analogy hits the nail on the head. And you just used the term medical device, which brings up a critical point about why this landscape is so dangerous.
Okay, how so?
Well, dermal fillers, despite being injected into the body to alter tissue structure, are not currently classified as prescription-only devices.
Wait, really?
Really. Legally, anyone can buy them off the internet and anyone can inject them. This absence of primary legislation exposes the public to unmitigated daily risk.
Which begs the question, if people are getting injured and the lack of regulation is staring us right in the face, why hasn't this been regulated already? Is it simply because the traditional medical world views these procedures as purely cosmetic and just dismisses them as vanity?
What's fascinating here is exactly that legal blurring of lines. It really all comes down to how the law defines what is a medical procedure versus something that is purely cosmetic.
Okay, break that down for us.
Historically, healthcare regulators, like the Care Quality Commission or CQC, they have had a very specific, rigid mandate. They regulate activities meant to treat disease, disorder, or injury.
Let's see if I follow. It's like having a city building inspector who is only legally allowed to check buildings that are currently on fire.
Oh, that's a good way to put it.
Like, if a building is structurally unsound, full of hazards, but not actually burning at that exact moment, the inspector just has to shrug and walk away.
That is exactly how it works. If a procedure doesn't have a strict, demonstrable health-related component, say you are having a filler injected solely to change the shape of your jawline for aesthetic reasons, it falls outside the definition of treating a disease or injury.
So it's a loophole.
A massive one. It historically fell right into a massive regulatory blind spot. The CQC couldn't touch it, and no one else was legally empowered to step in and monitor the safety.
So because it was deemed vanity instead of medicine, it just slipped through the cracks of the law.
Precisely.
But the government's consultation document is finally proposing a structured way to close those cracks, right? They are proposing a 3-tier traffic light licensing scheme to categorize the physical risks of every procedure on the market.
Yes, and this represents a massive paradigm shift. Instead of ignoring the industry, the government is attempting to categorize procedures strictly by their level of complexity, their invasiveness, and the specific physiological complications they present.
Walk us through this framework, because if you ever plan on getting a treatment, understanding where your procedure falls is absolutely crucial. Start with the green category.
So green is deemed the lowest risk of complications. Under the proposal, all licensed practitioners, even those without a medical degree, can perform these procedures, provided they meet agreed baseline hygiene and training standards.
What kind of treatments are we talking about here?
We are talking about treatments like microneedling, superficial chemical peels, intense pulsed light or IPL therapies, and micropigmentation, which includes things like microblading for eyebrows.
But wait, how do those actually work? Because microneedling literally has the word needle in it. Why is that considered low risk?
Yeah, it sounds intense, but it's all about the depth of penetration and the potential for systemic harm. Microneedling involves a device creating thousands of tiny superficial punctures in the outermost layer of the skin to stimulate collagen production.
Okay, so it's right on the surface.
Right. It bleeds, yes, but it doesn't enter deep tissue spaces or major blood vessels. Similarly, IPL uses scattered light energy to target pigment in the skin, and superficial peels use mild acids to exfoliate dead cells.
So it's about the physiological stakes.
Exactly. The key with the green category is that while these procedures do penetrate the skin or use energy, the potential for catastrophic, irreversible physical harm like organ failure or blindness is relatively low. They still require strict hygiene to prevent infections, obviously, but the stakes are lower.
Okay, that clarifies the baseline. But let's step up to the amber category. This is medium risk. What falls in here?
The amber category really shifts the rules. Non-healthcare professionals can still perform these, but they must be licensed, and crucially, they must have relevant oversight by a named, regulated healthcare professional.
And what's on this list?
This category includes botulinum toxin, widely known as Botox. It includes dermal fillers injected into the face, weight loss injections used off-label for cosmetic purposes, and platelet-rich plasma therapy.
Platelet-rich plasma. Is that what people on social media call the vampire facial?
It is, yeah. And the mechanism there is exactly why it sits in the amber category. PRP involves a practitioner actually drawing the patient's own blood from their arm, spinning it down in a centrifuge machine to isolate the platelet-rich plasma, and then re-injecting that plasma back into the face.
That sounds incredibly medical.
It is. You are dealing with drawing blood, processing it outside the body, and re-injecting it. The risk of transmitting bloodborne pathogens or causing severe infection if that centrifuge isn't sterile is significant.
Here's where it gets really interesting, though. I have to push back on this entire amber category.
Okay, go for it.
Injecting a gel into someone's face, drawing and spinning their blood, or handing out prescription weight loss drugs, that is only considered medium risk.
I know, it sounds counterintuitive.
Right. To me, anything involving a needle, drawing blood, or a prescription drug sounds like it should be strictly in the medical lane. Why is the government proposing to let non-healthcare professionals do this at all?
You are definitely not alone in thinking that. It is the single most hotly debated aspect of this entire regulatory overhaul. The medical community often shares your exact sentiment.
So why do it?
Well, the rationale behind keeping these procedures amber rather than moving them to the strictly medical red category is rooted in pragmatism. The government and the JCCP acknowledge a difficult truth. There are already thousands of non-medical practitioners, like beauty therapists, performing these injections on the high street right now.
Ah, so the logic is if you ban them outright, you don't actually stop the practice.
No, you just drive an enormous, highly profitable industry completely underground.
And if it goes underground, it becomes completely invisible to regulators.
Precisely. Instead, the amber category demands clinical oversight. By allowing non-medics to practice under a license, the government brings them into the light.
I see.
But the absolute necessity of the amber category is that oversight component. It means having a prescriber legally tethered to that procedure.
So there's accountability.
Yes. It is less about the physical act of pushing the plunger on the syringe, which, frankly, a beauty therapist can be taught to do safely, and entirely about having a medical professional accountable and available to step in the second something goes wrong.
That makes sense. And that sets up the red category perfectly then. If amber is a compromise, red must be the absolute limit.
Oh, absolutely. Red is the highest risk tier. These procedures are restricted strictly to qualified, regulated healthcare professionals. No exceptions.
So no high street salons.
Exactly. Furthermore, they cannot be done in a standard high street shop at all. They must be performed out of CQC-registered premises.
What pushes a procedure into the red zone?
The red category represents procedures that carry profound risks of permanent disfigurement, systemic organ failure, or require surgical intervention. Take deep phenol chemical peels, for example.
How does that differ from the green category peels?
Well, unlike the superficial peels, a phenol peel penetrates so deeply into the skin that the chemical is actually absorbed into the bloodstream. Phenol is highly toxic. If it is absorbed too quickly, it can cause severe cardiac arrhythmias.
Wow. Wait, so you could literally go into cardiac arrest from a face peel?
Yes.
That is terrifying.
It really is. That is why it requires continuous heart monitoring during the procedure and sits firmly in the red category.
What else is in there?
The red tier also includes thread lifts, often called PDO or COG lifts, where a practitioner uses a cannula to insert long, barbed surgical threads under the skin and physically pulls the tissue upward to lift the face.
Ouch.
Yeah. It also includes augmenting breasts, buttocks, or genitals with fillers. Injecting large volumes of filler into the buttocks, for example, involves massive risk to major blood vessels. That level of danger requires a CQC-registered facility with rigorous infection control and emergency resuscitation protocols on standby.
Okay, so the government is allowing non-medics to perform amber procedures like facial fillers, as long as a doctor is theoretically on standby to oversee things.
Theoretically, yes.
But let's test that safety net. What happens in the treatment room when a filler injection actually goes wrong and that doctor is nowhere to be found? Because the sources outline a complication that is truly terrifying.
You are talking about vascular occlusion.
Yes.
It is the critical nightmare scenario that regulators are desperately trying to mitigate.
Explain the mechanics of that. How does a simple filler cause a catastrophe?
Well, a dermal filler is essentially a thick, cross-linked gel. The human face is a dense, incredibly complex web of arteries and blood vessels. If a practitioner accidentally pierces an artery and injects that gel directly into the bloodstream, or even injects so much gel around a vessel that the pressure collapses it, the gel acts like a concrete plug.
Oh my God.
Yeah, it completely blocks the blood supply to whatever area of tissue that vessel was feeding.
And tissue deprived of oxygenated blood dies quickly.
It causes tissue necrosis. The skin turns white, then mottled, and eventually dies and sloughs off, leaving permanent scarring.
That is awful.
But it gets worse.
How can it get worse?
The arteries in the face are interconnected. If a practitioner accidentally injects filler into an artery near the nose or forehead under high pressure, that gel can actually be pushed backward through the vascular system, past the eye, and block the ophthalmic artery.
No way.
Yes. And when that happens, the patient is blinded. Irreversibly. In an instant.
That is horrifying, just from a cosmetic filler.
Exactly.
And the consultation document highlights a crucial, very narrow window to fix this. If an occlusion happens, you have about 4 hours to take prompt action before the damage becomes permanent.
4 hours, that's it.
The practitioner has to immediately flood the area with an enzyme called hyaluronidase, or hyalase, which literally breaks down and dissolves the hyaluronic acid filler, clearing the blockage. But here is the massive catch. Hyalase is a prescription-only medicine.
Which is exactly why the oversight model in the amber category is so vital and why the current lack of regulation is so dangerous.
Because they can't get it.
Right. Right now, an unregulated non-medical practitioner can legally buy and inject the filler, but because they are not a doctor or prescribing nurse, they cannot legally keep the antidote, the hyalase, in stock. They can create the emergency, but they are completely unequipped to reverse it.
Which brings us to the dark underbelly of how some practitioners bypass this rule. The sources outline the terrifying reality of remote prescribing.
Oh, this is a massive issue.
Because to get around the law, some unregulated practitioners use doctors who prescribe Botox or emergency hyalase via a quick video call. or sometimes just an online questionnaire. The prescribing doctor never physically sees the patient.
It is a severe breach of professional medical standards. Professional statutory regulatory bodies strictly forbid prescribers from authorizing prescription-only medicines without a thorough face-to-face physical assessment. Yet some clinicians still do it for a fee.
Just for a quick payday.
Exactly. They're operating commercially led prescribing networks.
That's like an air traffic controller trying to guide a commercial jet in for a landing when they can't even see the plane on their radar. They're just guessing based on a phone call.
That is an excellent way to frame it. When prescribers operate remotely like this, they completely fail to assess the patient's physiological suitability. And critically, if that vascular occlusion occurs, that remote doctor is usually hundreds of miles away and completely unavailable to physically manage the complication.
I want you, the listener, to really put yourself in that chair. Imagine you've just had a complication. The skin on your nose is turning white because the blood flow has stopped. You are staring at the clock, knowing you have 4 hours.
That's a terrifying thought.
And you realize the person holding the needle has no legal access to the antidote, no insurance to cover the reconstructive surgery you're going to need, and there is no supervising doctor on site because the prescription was bought online.
It is a systemic failure of patient safety. And what makes it even more troubling is our inability to fully track the scale of these failures.
We don't even have the data.
Exactly. The JCCP is urgently demanding mandatory national complications reporting. Currently, the primary mechanism the government relies on is the MHRA's Yellow Card scheme, which tracks adverse reactions to medicines and devices.
Wait, but if the practitioners causing the damage are unregulated, they aren't going to report themselves to a government database, are they?
Exactly. There is massive underreporting. Unregulated practitioners have absolutely no legal obligation to report their own adverse incidents. I mean, why would they voluntarily go on record to admit they caused a vascular occlusion or blinded someone?
They wouldn't.
Furthermore, the patients themselves largely don't even know the Yellow Card scheme exists. So the government is trying to make policy while operating in the dark, completely lacking the hard data needed to show exactly how much it is costing the NHS to surgically fix these botched procedures.
Okay, we've explored the physical dangers, we've untangled the regulatory loopholes, but I really want to explore the psychology of this industry.
It's a huge component.
Because how do we even get into that chair in the first place? How are these risky medical procedures being normalized and sold to the public as if they were just a haircut or a manicure?
If we connect this to the bigger picture, the lack of transparent information isn't just a physical safety issue, it is a profound mental health crisis. The aesthetics industry doesn't exist in a vacuum. It is driven by consumer demand, and that demand is heavily manipulated by modern marketing.
The social media pipeline is undeniable. You open an app, and you are immediately bombarded with edited, filtered, artificially enhanced images that create completely unattainable expectations for human faces.
It's constant.
Yeah, and the sources point out that this advertising frequently targets vulnerable individuals, exploiting underlying emotional and psychological challenges like body dysmorphia.
This is a major focus for the JCCP, which is why they are actively partnering with the Mental Health Foundation. They are pushing back hard against unethical marketing practices, specifically the gamification of medical procedures.
Gamification? You mean like those social media posts where a clinic has a spinning prize wheel and you can win a free syringe of lip filler?
Exactly that. The JCCP argues that offering competitions, prizes, and 2-for-1 promotional discounts for medical aesthetics completely undermines the seriousness of the intervention.
And trivializes it.
It does. It treats a medical procedure with serious physiological risks, like a trip to a casino. They are also demanding a strict crackdown on the advertisement of prescription-only medicines. It is currently a breach of Advertising Standards Authority guidelines to advertise a prescription medicine directly to the public, yet you see it constantly on Instagram and TikTok.
Oh, people literally put the word Botox in neon lights in their shop windows.
All the time.
But there is one area where the law has actually managed to draw a hard, uncompromising line regarding psychological vulnerability, and that involves minors.
Yes. In 2021, the Botulinum Toxin and Cosmetic Fillers Children Act was passed. It made it a criminal offense to administer injectables to anyone under the age of 18 in England, even if they have explicit parental permission.
Wow, even with parents saying, okay.
Yeah. It also made it an offense for a business to even arrange or book these procedures for an under 18-year-old.
Which makes complete sense. I mean, a 16-year-old's facial bone structure is literally still developing. Their brain plasticity and emotional maturity are still forming. The ethical implications of a minor giving informed consent to alter their face permanently just based on a TikTok trend are massive.
It is a vital safeguard. And the new licensing scheme proposes expanding that age restriction to cover all licensed procedures.
So all the green and amber ones too.
Yes. If passed, that means no microneedling, no chemical peels, and no laser hair removal for anyone under 18 unless it is specifically approved by a doctor to treat a diagnosed medical condition and carried out by a healthcare professional.
That's a huge shift.
It really aligns non-surgical cosmetics with the age restrictions we already accept for things like getting a tattoo or using a sunbed.
So what does this all mean for you? Let's synthesize everything we've unpacked today. The UK aesthetic industry is a 24.5 billion giant that is currently heavily fragmented and alarmingly underregulated.
Very alarming.
But change is finally coming. Through the JCCP's 10-point plan and the government's proposed traffic light licensing scheme, concrete steps are being taken. The ultimate goal is to ensure practitioners understand the anatomy they are altering, premises are equipped for emergencies, and you, the consumer, are protected by transparent information and real medical oversight.
But it is crucial to remember that until these laws are fully implemented and enforced, your knowledge is your absolute best defense.
Be your own advocate.
Exactly. The next time you look at a glossy clinic menu or a targeted ad offering a discount on fillers, you need to ask the hard questions. Don't just look at the price tag. Ask, who is the named prescriber overseeing this clinic? What is your exact redress scheme if I suffer a vascular occlusion? Are you listed on an accredited, verifiable register like SafeFace for healthcare professionals or the JCCP register?
Protect yourself first, because, going back to where we started, while regulators are finally trying to close the garage door and take the scalpel out of untrained hands, we have to ask ourselves something bigger.
Oh, for sure.
As cosmetic technologies evolve at breakneck speeds with new devices, hybrid laser machines, and aesthetic trends going viral on social media every single week, will the law always be stuck playing an endless game of catch-up with our own deep-rooted desire to alter our bodies? Something to think about.